Hello, everybody. Good morning, good afternoon, good evening, good night, depending on where you are. I'm Dr. Andrea Furlan, and I am here on Wednesday. I am so glad I'm able to do this. I blocked this time on my calendar. I hope to be able to do a live session every Wednesday. I really like this because it's more informal. You can see me in real life, and we can have a chat. And if God allows, every Wednesday, I hope to be here doing these live sessions. So thank you for being here with me today, making me company. And today we're going to talk about exercises. So I'm using my uniform. So if you watch my videos, you know that all of my videos of exercise, I wear a yellow shirt, and that is to make it easy for me to find the videos on my channel and for you also to find the videos. So wherever I am wearing a yellow shirt, you know I'm doing exercise, talking about exercises. So why don't we start? I'm so happy that you are all here. Glad to see some familiar names. I see Shamista, I see Steph Barber. Hi, Steph. Glad to see you are here again. And so today we have a agenda. I prepared like a little bit of a explanation of these exercises, what we mean by SSAR exercises, right? I talk a lot about SSAR. Even with my patients, I tell them, oh, we're going to demonstrate SSAR. I want you to do SSAR exercises. And they ask me, what is SSAR? So I have an opportunity to explain to them. So I'm going to explain to you exactly what I tell my patients when I'm seeing them in my clinic. Okay, so if you come to my clinic in downtown Toronto, Canada, and I diagnose you with myofascial pain, which is pain from muscles, you probably are going to hear me talking about the SSAR exercises. So we'll start. But before I start, I need to tell you that this live video is not intended to give you any medical advice. It is for educational purposes only. I'm not your doctor. You need to talk to your doctor. You need to talk to your physiotherapist if you want an individualized plan. This is more for you to have an idea. Even when you go to your physiotherapist, how do you talk to them? You can even ask your physiotherapist or your personal trainer or your occupational therapist or your professor saying, you know, what kind of exercise are we doing here? You can ask, and then you can be more mindful to have a variety of exercises when you're doing your treatment for muscle pain, okay? So this video is not intended to provide you medical advice. It's more for you to learn. If you need medical advice, if you need a diagnosis, please ask your doctor. And if there is any emergency during this video, please stop the video and go to the nearest emergency department or call an ambulance. Okay, so let's start. Oh, I see people here, you know that I ask you your name and to introduce yourself, so I love this. I see here Francis is there. Good morning, Francis. Nazra, your first time here? Welcome, Nazra. I'd love to know where you're from. I like, you know, because people from all over the world watch my videos, so I really, it touches my heart when I hear people from all over the world are watching. So if you can please write down where are you writing? Where are you watching from? So Aboom, Sharon, Hussein, and Steph is from BC, another Canadian here from British Columbia. That's very good. Yes. You notice that my chat, there is a delay. It doesn't allow you to, if you type something, you need to wait, I think, another 15 seconds to write something in the chat. That's how I set up the chat. So, because when I don't put this feature in the YouTube live, one person can be writing a lot of things and don't allow other people to have a voice. So this is just to allow everybody to have a voice in my chat. From Teresa from Ireland. Oh, wow, great. Nazra is from Minnesota, USA. St. Paul, excellent. And another one from USA, Francis, is from Porter, Texas. Thank you so much for watching today. It's really warmed my heart on this cold Canadian morning. Believe it or not, we're spring here in Canada, and it's still 0 degrees Celsius. I don't know how many Fahrenheit, that would be, but in Celsius, it's really cold. It's where we feel a lot of cold. Okay, but you're here to talk about exercises, right? You want to learn about exercise, SSAR exercises. So when we talk about types of exercises, we're talking about, and I'll be talking mostly about exercise for muscles, okay? Muscle pain, because we use muscles to do the exercises. Remember, muscles don't hurt if we apply pressure. So this is the biceps, this is the triceps. If I apply pressure in them, they should not hurt. But if you apply pressure to the muscles and they hurt, something is happening. You need a diagnosis. It could be myofascial pain, which is the most common cause of pain when you press the muscles, but it could be other things. So you need to have a diagnosis from your doctor. It could also be fibromyalgia. Fibromyalgia is not a disease of the muscles, although it hurts in the muscles because fibromyalgia hurts everywhere. Fibromyalgia hurts the whole body because the whole body, the threshold to feel pain is lower. So any small pressure in the body, even sometimes a touch, causes pain. So fibromyalgia is different. It's not because we are pressuring the muscle that the muscle is the problem. It's because the pain system is malfunctioning. The threshold is lower. The person has central sensitization. So fibromyalgia also hurts the muscles, but hurts everywhere. Not even the muscles. Okay. We're going to talk today about myofascial pain. So myofascial pain, for those of you who don't know, I have a video in my channel, and I can put the link there for you to watch that video later. But myofascial pain it's a muscle problem. There are areas inside of the muscle that are lacking oxygen, a little tiny area, and that area is tight. So the fiber is tight. So it causes referred pain. Usually the muscles, if the problem is in this point here, let's say that the trigger point is here, it's not going to hurt here unless if I press here. But when the person uses the muscle, they're going to feel referred pain. And referred pain is distant. Muscles don't usually refer to the place where it hurts. They refer at a distance. So the heart is a muscle. If there is a problem in the heart, like an infarct in the heart, they're not going to say the pain is right here. The person will say, oh, my pain is in the jaw, or my shoulder, or my stomach, or my back, because muscles refer pain away. Okay, so any muscle of the body. So for example, this muscle here, the upper trapezius, I usually have a trigger point here. So if there is a trigger point here, I'm pressing here, it hurts. But when I'm using that muscle, the trapezius, the pain is not here. It's usually shooting up. Okay, so that's the kind of pain we're going to talk today, because SSAR is used for myofascial pain from trigger points. Okay, so how many types of exercises we can do? Like there are, can someone type, type in the chat, like one line, all the types of exercise that you can think of. Types of exercise. If you know already what is SSAR, you can say in the chat, SSAR is blah, 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 blah. Okay, let's see if you know. And Stephen is in Nigeria, Africa. Hi, welcome, Stephen. I think it is evening for you. Francis, you do the chair exercises with me. I hope you like it. Hussein, originally from Cyprus, but now living in New York, USA. So you're now in New York, very close from here. And Oledumi is watching from Houston, Texas. Okay, people, you need to participate. This is a live session. I want your interaction. Can you type in the chat? What do you think are types of exercise? And if you know what is SSAR means, you can type in the chat before I tell you the answer. A little bit of suspense here. Nobody? Nobody knows what are the types of exercise? Okay, so I'll give you the answer. So we have strengthening exercises. Strengthening, the muscles need to be strengthened. If a muscle is weak, we need to strengthen. That is also called resistance exercises. When we apply resistance, we can talk about resistance against gravity. So if I want to strengthen my triceps, I can use gravity. So if I do this against gravity pulls my arm down. If I go against gravity, I am contracting my triceps against gravity. So this is a type of resistance exercise. So if you're dancing and you're doing this, you're doing resistance exercise for your triceps. So maybe at the end of your dance, if you do this many times, those muscles will be hurting because you did a lot of strengthening. You were strengthening the triceps. Okay. What is another type of exercise? So we saw strengthening. Can anyone think about another one? Oh, and strengthening we can do against gravity, we can do against our own body weight, or we can do extra weights, right? So, oh, I don't have my weights here. I forgot them. I forgot it because I was practicing with my weights in my bedroom the other day, and so I have my hand weights. But let's pretend that these are weights. This is a beautiful stone from Brazil. So if I do this with weights, I'm now doing resistance with weights, right? Okay, someone wrote here. Okay. Bhagwanti, stretching, strengthening resistance. Teresa wrote aerobic. Okay, we are in the right track. Good, people. Stretching. Okay, we're getting there. Excellent, excellent. I feel like a teacher in a classroom. Okay, so we talk about strengthening, and that's the first S of the SSAR. Muscles need strengthening, because usually muscles that have myofascial pain because they hurt when you move them, they're weak. So muscles that have myofascial pain, so your doctor or your physiotherapist need to examine you and tell you, okay, you have myofascial pain of the trapezius, the levatoscapula, the scalenes, the pectoralis. So they will write down for you which muscles you have the myofascial pain, okay? So you need to strengthen those muscles because they're usually weak. The second one, who said stretching? Yeah, Bhagwanti said stretching. Excellent. So the muscles that have myofascial pain, like they don't want to be used. They don't want to be contracted. They don't want to be stretched. Stretching is also called flexibility exercises. It means that you are extending. So if I'm contracting, if I'm bending my elbow here, right? I'm contracting my biceps and I'm stretching my triceps. You see here? So if I do this, this is contracting, this is stretching. Now, when I extend my elbow, it's the opposite. This is contracting and this is stretching. So this has to relax when I do this. And our brain is so smart and our body is amazing. We have in the spinal cord, we have a reflex. Every time you send an order to contract a muscle, like the triceps here, my brain sends a message to my spinal cord, and the spinal cord will tell the opposing muscle needs to relax. Okay? So if you want to relax this muscle here because this one is hurting, you contract the other one, the opposing, and this will relax by default. Okay, so we have that reflex. Okay, we talked about stretching, strengthening. So stretching or resistance exercises. So strengthening or resistance exercises. And then we have stretching or flexibility exercises. Now we have another type, right? The other type, SS. So we already talked about stretching, strengthening, stretching. What is the third type? SSAR. The A is for, I don't like to do that symbol. The A is for aerobics or cardio exercises. So what does it mean to do cardio or aerobic exercises? It means that because you are consuming more oxygen, your muscles are using oxygen. So your heart needs to beat faster, your heart rate increases. You also need to breathe faster because you need to pull more oxygen from the air and you need to expel more carbon monoxide that you are producing. So when you're doing cardio or aerobic exercises, it means that you are using more oxygen and your blood pressure goes up because it needs to pump oxygen to the whole body. And that's good to flush those areas of those tiny little areas inside of the muscle that were lacking oxygen. Remember, the myofascial pain is a tiny little area. The trigger point is a tiny little area inside of the muscle that is lacking oxygen. So it's really helpful if you increase your heart rate, increase your respiratory rate, increase your blood pressure to pump oxygen, to pump blood to all muscles of your body. So any exercise that will accelerate your heart rate is cardio or aerobic exercise. Going up and down stairs, swimming, biking, running, dancing, so many examples of aerobic exercise. So SSAR, strengthening, stretching, aerobics. What is the R? Okay, does anyone know what is the R? Yes, so Nancy said aerobics is strengthen. Yeah, Hussein said stretching hands on our body while we are pushing our body against the flat wall. Francis, does this include pain from TMJ? Yes, pain from TMJ. We have a muscle. I have a video about that, Francis. Bisnu got it. The R is relaxation. Very good. Steph, the R is relaxation, because resistance is the same thing as strengthening. Okay. Yes, so talking about the TMJ, I have a video about TMJ disorder. We have a muscle here called masseter muscle, very potent, super potent. It's the muscle that makes our clench our mouth. And it's so powerful that there are some circus people that they can bite something and they can do acrobats in the circus just with these two muscles here. So these two muscles are so potent that they can hold the whole body weight of a person when they're doing those acrobats, right? So this muscle here can have myofascial trigger points, yeah? So sometimes I treat people with masseter muscle. So if you do like this, you will see, if it hurts, again, if you do this, the muscle hurts, then the person probably has a myofascial trigger point, okay? So these are the types of SSARs: strengthening, stretching, aerobics, and the last one is relaxation. Yeah, because relaxation, our muscles also need to relax, and we usually forget. Relaxation is so important for myofascial trigger point. There are other types of exercise too. There is the balance exercises, like equilibrium or stability exercises. They are used to improve posture, to reduce the risks of falls, and to better improve our ability to maintain balance. So people who are at risks of falls, they also need to do balance exercise. That's why in my other videos, especially the osteoporosis one, I have the letter B, and B is for balance. But for muscle pain, we don't need to worry about balance exercises. And there is also another type of exercise. Well, it's not really a type of exercise, but we use this term a lot. It's called endurance. Endurance is the ability of sustaining an exercise for prolonged periods, okay? Endurance means, let's say you're doing aerobic exercises, but you can only do for 2 minutes. Now, when you start practicing for endurance, you're going to increase how long you can sustain that exercise. And endurance could be muscle endurance, so you need to train your muscles. It could be cardiovascular endurance, because you need to train your heart and the lungs to pump more oxygen to them. Some people have failure, they can't sustain an exercise. It's not a problem of the muscles are very strong. It's because their heart and the lungs are not good enough, healthy enough to be able to extract oxygen from the air and get rid of the carbon monoxide for a prolonged period. But endurance can also be emotional. Some people can't endure exercise because they are depressed, they are fatigued, they don't sleep well, so they don't have energy during the day. It could be because they don't eat well, they don't have nutrition to maintain endurance. Because if you want to maintain doing the same exercise, and the same exercise could be resistance, but it's usually cardio or aerobics, you need to have energy to be doing that. So the marathon runners, they train all of this, right? They train for cardio, aerobics, endurance, but they train for endurance, muscle endurance, heart and lungs endurance, and emotional endurance. And they also need the energy. right? So they need the nutrition to be able to do the exercises for a long time. Okay, so yeah, Bisnu is a lifestyle therapist for fitness. So great, you know that. Nazra, have you relieved sciatic nerve pain? Yeah, I have some videos about sciatic nerve pain. And Diba is from Toronto, so here close to me in Toronto. That's great. Okay, so now when we talk about some mixed kinds of exercises, so when people come to me and they have myofascial pain, they have those trigger points, and I say, oh, you need to do the SSAR exercises, there's one type of activity that fills all of those SSAR, and I love that because it's aquatic exercises. When they do these exercises in the pool, inside of the water, aquatic, hydrogymnastics, they're doing all of these exercises because the water will create resistance. So they're doing the strengthening. They can do stretching inside of the water or after they do the aquatic, but they can do stretching in the water or outside of the water, but they can do. So they will be doing the second S, the SS. If they start, doing exercise in the water and they're going to be having difficulty to maintain their breathing, that's because they're doing exercise. So if they're in the water doing exercises, aquatherapy, dancing or swimming, whatever, and they start, they go like this, it's because they are doing aerobics, cardio exercise. So they're doing the third type of exercise. And if the water helps them to relax, because especially warm water is good for people with muscle pain. So the muscles will also relax. So they will be doing all SSAR in one activity. They don't need to worry about doing all the other exercises. Yes, so Nazrin is asking about, hi from Turkey. Hi, hello. And what kind of exercises for fibromyalgia and IBS? You have both of them. I'm sorry to hear that. And I don't have for IBS, irritable bowel syndrome yet. I don't have a video about IBS. I need to do one on my channel. But for fibromyalgia, Nazrin, I do have a lot of videos. I think I have 4 videos. I can get the numbers for you about exercises for fibromyalgia. The first video is more like I'm explaining what kind of exercises, and the other ones I am demonstrating. I'm doing the exercises and you can do with me. So the types of exercises for fibromyalgia are mainly stretching, resistance, and aerobics. Of course, you can also do the relaxation exercise, but aerobics is really important to pump oxygen to the muscles, okay? So I'm going to put here in the chat some links to, I have a video that I am demonstrating SSAR exercise for neck pain. This is the link here. I hope you can, I don't know if the link works, but that's the video number 12 that I'm doing the SSAR exercises for trigger points of the trapezius, scalenes, levatoscapula, what else? And sternocleidomastoid, the one in the front, okay? So if you want to see how to do SSAR exercises for the neck pain, you can watch that video. I have one for low back pain. It's video number 16. Yeah, and Psalm says, I find that doing resistance band training using not PT bands, but thick weight lifting bands not only strengthen my muscles, but works on the core and balance. Yes, that's great. Yeah, resistance bands are great. Yeah. Cardio workout. Yes, cardio workout is the A in SSAR, aerobics. Okay, that's great. Yeah. And then I have another video that I also demonstrate SSAR for mid-back pain for people who have it. So I have a video for the neck, I have a video for the lower back, and I have another video for SSAR of the mid-back. I'm going to put the links here on the live chat, okay? And I also have an explanation of all of this in my book. I put a sticker here so I remember which page. So this book here is the 8 Steps to Conquer Chronic Pain on page 232. So if you have my book on page 232, I explain exactly the exercise for myofascial pain syndrome, what causes myofascial pain syndrome. Oh, the other thing that is really important is because myofascial pain syndrome starts in the muscle, if it's not treated properly and fast, it can sensitize the pain system and transform into central sensitization with fibromyalgia because it's sensitized. So it's really important to treat, to eliminate these trigger points quicker. So I talk here about the modalities that you can use to eliminate trigger points. So SSA exercises, modalities like superficial or deep heat, electrotherapy, laser, biofeedback, relaxation techniques, cognitive behavior therapy for anxiety and sleep, because if the person is not sleeping well, the myofascial pain probably will be really hard to get rid of. Manual therapies, deep massage and mobilizations, acupuncture and dry needling, injections. Sometimes I need to do local anesthetics. I don't inject botulinum toxin and I don't inject steroids in the muscles. If I need to do injections, I do either lidocaine, which is a local anesthetic, or I do dry needling, that I don't inject anything. Also, a person can use NSAIDs and muscle relaxants for a short period of time if they have trigger points. And if they have myofascial pain syndrome for a prolonged time and they're not sleeping well, maybe we'll need to enter some antidepressants. I like to use tricyclic antidepressants like amitriptyline or nortriptyline, and I have a video about amitriptyline on my channel. And there are some things that they need to avoid. So if they have trigger points, myofascial pain, they need to avoid drugs such as opioids, benzodiazepines, and baclofen. And in order to avoid the pain from recurring, from coming back, they need to see what is causing that myofascial pain. So they need to work on better ergonomics, a better workstation, environmental temperature, and shoes, okay? Also improve sleep position and sleep hygiene. So then I also talk here. So I'm reading from the book, and I talk a lot also what are the techniques that we can use to do the relaxation exercises on this page here. Okay, so for those of you who don't know, these books can be purchased. I have two books now. I have this one, which is the 8 Steps to Conquer Chronic Pain, that I'm reading from page 232 for you. And I have another one that is the You Are Unique and So Is Your Pain. So then this one is for you to write on it. It's more like a guided journal, 90 days, and a lot of things that you can write to discover things that you did not know about yourself. It's more like to discover your resilience, your strengths, things that you can do. I don't want you to be thinking about your pain. I want you to forget your pain and live your life. So that's what that book is about. Okay, so then I think we're closing. I'm very close to the end of this live. Thank you all for participating. This is lovely. Nazreen, Diba, Riley from Maine, Diba from Toronto, and Steph. Oh, you have the journal on order. That's great. So I would love if you, when you get the book, if you already have my book, please write a review on the store where you bought it. It really helps other people when they are trying to think, should I buy this book or not? People read the reviews, the ratings, and I would love if you can write a review about my books, both of them. That would be an excellent thing that you can do for me. If I have been able to help you anyways, in any form, and you want to thank me, the best thing is for you to get my book, write a review. I hope it's a nice review, but it's up to you. You write anything you want, because I think that will help more people to get motivated, to read, to understand, to learn what's going on with their pains, because pain is so common. It affects 1 in 5 individuals. Okay, so I hope to come back here next week, next Wednesday. I'm hoping to do this every Wednesday, if God allows me to do this. And if you want to suggest topics for us to talk on these lives, I'm open for suggestions. Thank you so much for joining today. And I hope you like this video and leave your comments on this video as well. Bye.